A bill aimed at lowering prescription drug costs for Vermonters is on its way to the Senate after passing out of the House with bipartisan support. This has to do with Vermont joining a coalition called ArrayRX, which is states pooling their buying power together to negotiate cheaper drug costs. ABC 22's Matt Holderman joins us live in the newsroom with more on the program and just where things stand.
Yeah, Lauren, that's right. This is the effort that's being led by the state treasurer's office and the chairs of both the House and Senate health committees. They say now is the time for Vermont to join a collaboration like this, and they are happy the bill has seen mostly smooth sailing so far.
This is exactly the kind of smart, practical policy proposal we should be advancing.
State Treasurer Mike Pieciak claiming a small victory for Vermonters Thursday afternoon as the state moved one step closer to joining a coalition he says could make prescription drugs more affordable, accessible, and sustainable.
Drug costs are already too high in this country, and the year-over-year increase continues to go up.
The idea is Vermont hopping on board what's known as ArrayRX, a collaboration where Vermont could combine its purchasing power with that of other states on board, such as Connecticut and several on the West Coast. Pieciak says in those other states so far, the average savings has been 80% for generic drugs and 20% for name-brand medications. If the state legislature approves the plan, every Vermonter would be allowed to get a free ArrayRX card that would let them buy those more affordable drugs offered through the program, or at the very least compare ArrayRx's drug prices to the ones offered by their insurers. The Vermont House passed the measure this week, and senators are already signaling they could soon do the same, especially with federal cuts to Medicaid and ACA subsidies being kept in mind.
As insurance companies need to reduce coverage for prescription drugs, we look forward to having that high volume pool of drugs available through ArrayRX.
One concern that's come so far is from some independent pharmacy owners around the state who are worried this could impact their profitability. Pieciak says of the states that are already on board ArrayRX, they've only had positive outcomes to report, and he thinks Vermonters need this money-saving opportunity.
You can't say in every instance it's going to be the best reimbursement rate for each pharmacist, but generally across the board, it is going to be better than other cards that are available.
Now, another important note, Pieciak says this will not raise taxes or have any ongoing costs for Vermont. There are some upfront costs to join the collab here, but once Vermont is in, lawmakers say they won't need to use any state dollars to stay in. The bill on this could still undergo some amendments, but Senator Lyons says at the moment she doesn't think it needs any changes. Reporting live in the newsroom, Matt Holderman, ABC 22 News.